Bismillahirrahmanirrahim. Assalamualaikum everyone and good afternoon. Welcome to the forum for today that is held to learn on anemia. First of all, let me introduce myself. My name is Nur Fatihah binti Bahdin with the metric number 201008 and I'm your moderator for today. This forum program will talk about something that is very interesting. So let's not waste our time. Now, I will introduce all 7 panels for today. The first panel is Muhammad Fikri bin Ahmad with metric number 202156. Panel number 2 named Nur Alia Faika binti Muhammad Fazli, matrix number 200759. And the third panel is Takrisa Najla binti Zainul Arifin with metric number 200753. The fourth panel is Izzatul Farhanis binti Abdul Halim, metric number 203650. The fifth panel is Nur Khairunisa Nadia binti Muhammad Ali with metric number 202157. And the sixth panel is Ms. Chia Kaisi, matrix number 202412. And the last one is panel number 7 and her name is Sumaya Darwish Marbaha with metric number 200116. To our panels, I would like to say welcome to the forum for today. 1 in 5 Malaysians suffer from anemia according to a survey by the Health Ministry of Malaysia, while National Health and Morbidity Survey (NHMS) found that 21.3% Malaysian has anemia. From this statistic, we can see that anemia is prevalent among people in our country. So, what is anemia? Anemia is a condition where the amount of red blood cells and hemoglobin decreases in the blood, and there are many types of anemia such as impaired red blood cell (RBC) production or increased red blood cell destruction, also known as hemolytic anemia. To understand more about this, we will discuss it through a case study with our panels for today. So let us start with getting to know the case. Okay, the case is about a 1-year-old girl that was investigated for 10th percentile of height and weight, pale with her hemoglobin of 0.8 gram over deciliter. Her sister, Adriana, 5-year-old, was hospitalized every 1 to 2 months so she could be transfused with packed red blood cells. So, without further ado, let us start with the first panel, Ms. Nur Alia Faika binti Muhammad Fazli. So, my first question is, can you explain what is the possible reason of the statement investigated for 10th percentile of height and weight in this child? And can you explain a little bit what does it mean by 10th percentile of height and weight?
Okay, thank you, Ms. Moderator Nur Fatihah. To start, we first need to understand what does it mean by 10th percentile of height and body weight. The higher the percentile number is, the bigger the child will be in comparison to the children of the same age and gender, whether it's for height or weight. Same goes with the lower the number of percentile is, the smaller the child will be. And in this case, the baby is investigated for 10th percentile, which means that the baby is small. It is also mentioned that the hemoglobin is low. So the question is, how does hemoglobin affect growth? Studies shows that hemoglobin concentration is positively correlated with body height and with serum insulin-like growth factor 1 and IGF binding protein 3. So in infants and young children, low hemoglobin does lead to delayed growth. That's all from me. Back to you, Ms. Moderator.
Okay, from the first panel, we can understand that that 10 percentile means that the baby is small, and we can see that hemoglobin plays a very important part for children's growth. So, the second moderator, I would like to ask you, can you relate the answer in A with the possible problem in this patient? Why do you think what is the possible problem for the child?
Okay, thank you, Miss Moderator Nawatiha. So, first of all, let me list out the symptoms that she had. Firstly, her height and weight. Her height and weight was 10 percentile, clearly shows that she suffered physiological growth and developmental delay. Pale with hemoglobin, in other words, hypochromic and low concentration of hemoglobin, which is 7.8 gram per deciliter. For your information, 1 years old female child normally contain concentration of hemoglobin range from 11.3 to 14.1 gram per deciliter. All these symptoms lead to beta thalassemia major disease. The fact that her 5 years old sister was hospitalized every 1 to 2 months to complete blood transfusion and treatment strengthened the hypothesis. This is because beta thalassemia major is a genetically disease that inherit the trait from their parents. That's all from me.
Okay, thank you, Mr. Fikri, for that opinion and explanation. Uh, let us continue with the third panel. So the third panel, can you see and what can you see from the complete blood count of the patients?
Okay, thank you, Miss Moderator Nur Fatia. Okay, so from the patient's complete blood count result, we can see that the count of hemoglobin is low, which is 7.4 gram per deciliters. This shows that the patient is having a moderate anemia. Other than that, the mean cell volume is also low, which is 64.4 femtoliters. So the low mean cell volume means that RBC is microcytic. Thus, we can conclude that she is having moderate microcytic anemia. Okay, that's all from me. Thank you.
Okay, thank you, Ms. Takrisa Najda, for the explanation. So, from her explanation, we can see that this patient is possibly have moderate microcytic anemia. So, to understand more about this, I would like to ask the fourth panel, what do you think we can from this information, what do you think the diagnosis that we can make, and can you explain a little bit on that?
Okay, thank you, Miss Moderator. So, from the CBC just now, so I suspect that this patient might develop moderate hypochromic microcytic anemia, and these patients are also maybe the disease may be congenital and is inherited from the parents, since the statement state that the sister also have the same problem, need a blood transfusion 1 to 2 months. So this shows that they may be inherit this disease from their parents. Okay, I also suspect that this child have low level of iron, since iron is a major component of hemoglobin and her hemoglobin is lower. Okay, therefore I concluded that there are two possibilities disease that she might suffer with. Okay, one is thalassemia and another one is iron deficiency anemia, because both diseases are can be inherited and also related to hemoglobin disorder. Okay, that's all from me. Thank you.
Okay, thank you, Ms. Izzatul Farhanis. So from what just have been explained, we can see that there are two possible diseases for this patient, which is thalassemia and iron deficiency anemia. So I would like to invite our next panel to explain and describe the possible findings in her blood film.
Okay, thank you, Miss Fatiha. Okay, so you can see from the screen, this is the blood film of iron deficiency anemia. Okay, so this, as Izatul said just now, the patient has suspected with two possibilities, which are iron deficiency anemia and thalassemia. So from this screen, okay, if the patient is suffering with iron deficiency anemia, the patient might have a pencil cell shape of red blood cell and also hypochromatic cell. Okay, the white part is more than the red part. Okay, when is an anemia, so it is less red color than white color. Okay, so that's why we call it as iron deficiency anemia. Okay, and other than hypochromatic cell, we also can see that this patient might have pencil cell red blood cell, okay, due to decreased red blood cell turnover and production. Okay, other than iron deficiency anemia, the patient also has suspected with thalassemia. Other than iron deficiency anemia, the patient might have thalassemia as well. So for the thalassemia, on her blood film, we can see that the patient might have a nucleated RBC, okay, hypochromatic cell as well, because it is an anemia, and also a target cell. So when the patient has thalassemia, we can see this kind of blood cell on their blood film. Okay, so that's all from me. Thank you.
So, thank you, Miss Nadia, for the explanation. From her explanation, we we can only see two possibilities of the patient's disease, which is thalassemia and iron deficiency, based on the peripheral blood film that has been presented. So, because we couldn't find a very we couldn't find a specific diagnosis for the patient yet. So I would like to ask our other panels, what do you think are the further laboratory investigation that we can do to more confirm on the patient's disease, to confirm more on it? So yes, I would like to invite Ms. Kaisin to explain her opinion on this.
Okay, thank you, Miss Moderator. So, in my opinion, based on the case study, we understand that there will be two possibilities that this 1-year-old girl will defected in disease on iron deficiency anemia or thalassemia. So we can use iron study to actually further investigate on this case. Yeah, so because of iron deficiency anemia only occurs if the child doesn't consume enough of iron, or it might not have a very good absorption of iron, and then it might cause the level of ferritin to be reduced, and actually it shows in the result of iron study. But if the child are having thalassemia, the iron study will show the result on normal level of ferritin, and actually we can see that based on the both of the results, we can understand that whether the child is defected in thalassemia or iron deficiency anemia. Yeah, so that's all from me.
Okay, thank you, Miss Kaisin. It seems like Miss Sumaya, our next panel, would want to add more on other further laboratory investigation that we can do. So, Miss Sumaya, what do you think other investigation that is appropriate to understand more about this case?
Hi, Ms. Fatiha. So, as Kaisen said that for possibility of iron deficiency, we can confirm that that this girl has thalassemia by doing the hemoglobin electrophoresis. That we were looking for the abnormalities in the hemoglobin level. So the result will be different, but generally speaking, that we will see that HB A2 will be increased, but HBF will be sometimes increased. So that's my opinion. Thank you.
Okay. From our 6 and 7 panel, we can see that further investigations such as iron test and hemoglobin electrophoresis can be done to confirm on the patient's disease. So I would like to say thank you to all the panels for a very fruitful discussion. We have come to the end of our discussion. Honestly, there are more questions that I would like to ask our panels for today, but as the time is running out, I will conclude that this patient could have two diseases, whether it is beta thalassemia or iron deficiency anemia. So, and we can do further investigations that is suggested to more confirm about this. Okay. Lastly, our anemia is very prevalent in our country, and it could happen to our friends, families, or even us. So I hope through this forum, we can become more aware on anemia and improve the public health knowledge among Malaysians. So thank you for watching and see you again. That's all for today.